Great. Good evening. So this is probably going to be well, maybe not our last video. I've got a video office hours tomorrow, but it's December of all times, December 3rd, and we're going to talk about the last assignment primarily. First, I'm going to open up for any questions. Yes, I'm still grading the last assignment. Bear with me. I had a setback over Thanksgiving. I actually took some days off, so it's like I'm trying to catch up. Everything I see so far on the clinical note has been really good across the board. So don't worry about that. I'll get that done this weekend. Any other questions, comments, complaints, criticisms, confabulations? All right, I'm running out of C words here. So let's talk about this last assignment. Actually, I think this is the best or the most fun assignment for the course here. Let me ask you a question. We're all working nurses, and have you ever been in a situation, clinical situation, management situation, whatever, and you just kind of shake your head and says, we got to do a better job. This process is just not working. Everyone shake your head. Yes, we've all been there. We kind of go, oh, why did they design it this way? Or if they'd only do this, we could do so much better, get the patients out of here quicker, patient care would be better, things like that. So this assignment gets to the crux of that. We need to think about two things tonight and relate that into the assignment. First is workflow, and the second thing is information flow. So think about your clinical setting or your management setting, wherever you're at, and begin to think through all the different steps, all the different parts of the processes that make care deliverable. A simple thing. Let's just do a real, say, a simple intake in the ED. So you're a triage nurse. What would be some of the things, the steps, some of the processes, the workflow that would occur if you were a nurse at the triage desk at, say, a community hospital? What were some of the component parts of that?
A quick assessment of the patient.
Okay, you're gonna do an assessment. Okay, and then what? You're gonna make some decisions, right? That's the decision desk. What has to happen?
To identify if they're critical or stable, and figuring out, how urgent they are and when they need to be seen based off of what you've assessed.
Okay, so real quickly, they're coming in, they're having chest pain, they're diaphoretic. They go right back, right? They get into a acute bed, they get on a monitor, things like that. You come in with chest pain 4 or 5 days, and you were lifting a box, and you think you're having a heart attack because, God, this thing has just been sore as the dickens. And you ask them to take a deep breath, and they say, does it hurt worse when they do that? Oh, God, how's like hell when I take a deep breath? Where are you going to put that patient? Right back on the monitor also?
No.
Their vital signs are normal. They're, all those things. So again, even subtle things like they present with chest pain, you go, oh my God, this is a MI. Well, no, it could be respiratory, it could be costochondritis. I mean, you pulled a rib or broke a rib or something like that. So there's a bunch of things that have to happen from a workflow standpoint to get the best care. You want to triage or sort through all the different patients that are arriving at different times, sometimes in clusters, and then make decisions as far as do they need to go right back, or can they go in the waiting room, or do I need to keep an eye on them just in case I need to bring them back? So that kind of gets into the guts as far as, first, what does the workflow look like? But the second piece of this is the information flow. So let's say that, let's go back to the chest pain patient. They present, it's 11 o'clock at night. No, let's say it's 4 o'clock in the afternoon, and the Denver Broncos just lost again. This guy's having crushing chest pain. Like a lot of us did on Sunday. Never mind, I won't go there. But what is the information? Let's say you decided to bring that patient right back. What's the information flow in order to provide optimum care? You're just going to go back and put the guy in the bed and walk away?
Usually it's their criteria. Like there's always some sort of level of prioritization that you use. Okay. Help me out here, y'all. Yeah, sure. I don't do this for a living, but there's always, when I did ER, we had like patients who are cat 1, 2, 3, 4, and if he's a 1, that means they're trauma, and 2 means that they're urgent.
Okay.
things of that nature. I'm not an ER person, but I know that
That's
happens.
okay. I did my purgatory for about 1.5 years, and I went back to the ICU. I was like, no, this is not me. Anyway,
So that would be the information flow, whatever
what's the
their
information?
category is.
But think about it for a second. If it's a trauma versus an MI or possible MI, there's different teams. So if it was a trauma that came in, what would the information flow that would trigger certain actions?
It trigger trauma.
Someone help out. Someone
Yeah,
help out Hannah.
You'd have to activate the trauma team.
Okay.
I'm sure there's a trauma team that you'd have to activate. I don't work in that either. I've been outpatient for a while.
But good. So it's a trauma coming in. Let's say you're at the where the radio is. Usually the radio is at the triage desk or somewhere close by or something like that. You hear an ambulance coming in, multiple trauma. Who would be responsible for getting the trauma team? Usually the trauma teams from all over the house, all over the hospital. You need to get anesthesia down there. You need to get if you're in a teaching setting, usually you get the senior resident, the attendings and stuff like that. So who's responsible for calling all these people?
The charge nurse and the physician, the primary physician on staff, they page them.
Could be, or
the bed coordinator.
Overhead page.
Bed coordinator needs to be acknowledged, especially if you got like a bad accident, you can have multiple casualties, things like that. Okay, good. What else? I'm just trying to prime the pump here for this is a pretty straightforward process workflow diagram and information flow diagram. Anything else? This Thursday night, we're kind of toasted, aren't we? I'm kind of zoomed out, but just bear with me. I got my raspberry zinger tea here. So if you're trying to map the process, why would you even want to map out this process? Why would you want to do that?
Well, you want to make sure that it's as efficient as possible, that you're not missing any steps, that you're not missing any team members.
Okay, as far as doing the assignment, but why would you do this just in general? You want to?
Well, in general, I think the same reasons. I think, you want a process to be efficient. So if you're doing a workflow, you want to lay out the steps to make sure that you're not missing anything.
So efficiency, what else?
Well, making sure that the patient's getting the best care that the patient needs too.
Is it patient focused? Are we missing some steps here? Things like that. So let's go back to the MI. Anybody here cardiac nurses? Any cardiac nurses here? Or I'll help you out. I was a cardiac nurse for a long time. If you're having chest pain, what are the things you need to do from a diagnostic standpoint and do them as fast as possible?
EKG.
Labs for specifically what?
Troponin,
CK levels, things like that. Okay, good. So if we begin to think about this, if you have a delay, for example, in getting the EKG, you want to get a 12-lead EKG. Everyone's going to come in and put them on the monitor, but you need a 12-lead EKG because that's going to be diagnostic. You want to know where the ST elevation is or ST depression. It depends upon that 12-lead that could help better understand what's going on, what part of the heart may be in trouble. So as we begin to think about this, if there's a delay in getting the 12-lead EKG, for example, if someone needs to come down from upstairs to get it from the, usually in some hospitals, there's a tech that does the EKG. Sometimes the nurses are trained. When I was in the cardiac care unit, they trained us to do our own 12-lead because it decreased the amount of time to actually get the information to the medicine doc, the cardiology guys, and say, all right, we need to get this guy right to the cath lab, or let's wait till the enzymes get back. I'm not quite sure what's going on here. So a lot of these different things have to play simultaneously. And that's what we're going to talk about swim lanes here. So there's different people that have different responsibilities, and you want to actually begin to map that out to see if you can optimize flow. For example, in the trauma setting, there are some hospitals that are very advanced that they have really good working relationship with their EMS, their colleagues, that the paramedics, and the paramedics can sometimes go ahead and trigger the trauma team. So the trauma team's waiting when the ambulance get there instead of the triage nurse waiting and say, what's going on here? Oh, let's call the trauma team, So, or stroke, think about stroke. If I got one of my doctoral students, she's doing her dissertation on stroke care. They implemented the statewide stroke team, spent millions of dollars on it. And what you're doing is trying to actually see if they actually improve outcomes of care. The whole idea with stroke is you've only got about 90 minutes from the time that the stroke occurs in order to get either a thrombolytic or some kind of invasive, they go with the corkscrew, literally pull it out to revascularize the perfusion to the brain. But what's the exception to that? If you're gonna give thrombolytics, bust the clot. Yeah, it's great if you have a clot in your brain, but what other type of stroke is also possible?
You have a bleed or something instead?
Would you give a thrombolytic to someone with a cerebral bleed?
No.
Kill 'em. So again, it's critical, and she's actually looking to this time to get the CT scan to rule out a bleed, so they can actually give or do the intervention, stuff like that. So again, from a workflow standpoint, what they did at a statewide level is increase the overall awareness, organize resources. If they were in a rural setting that didn't have a CT, or if it wasn't working at 3 o'clock in the morning, they might divert the ambulance to another hospital, even though it may be another 20, 30 minutes down the road, because it doesn't make any sense going to the hospital. They can't give them thrombolytics, so you've lost your time window. So again, these workflow diagrams have direct implications for patient outcomes, good care, effectiveness, as well as efficiency and things like that. All right, so do you want to look? Let's do this first. I'm going to bring up the assignment so you understand what the assignment, what the requirements are. And actually, this is pretty simple. All you have to do is do a workflow diagram. I want you to send me a little paragraph or something like this so I understand what I'm looking at. So basically, you're going to take a clinical setting, it could be a management setting, it could be a lab, anything that you want, and do a workflow diagram. That's the main bulk of it, just to get you to go through this process and think through. Some of you, when you finish, may actually be in a position where you may do these kind of things. Hannah, you're going to be a clinical specialist. So these are some of the things that you might actually be doing when you actually get out, when you're finished here. So think about how you would actually do this. Let me bring this up. Let's see if I got this set up correctly. You guys seeing the Canvas thing here? Yep, okay, good. So the deliverable here is a workflow diagram. That's pretty simple, isn't it? Now, there's several different options you can do. First, again, it doesn't say specifically here, but I want at least, a basic paragraph of what it is I'm looking at, what you're trying to accomplish. So again, if you were in the ED setting, you were trying to understand and improve a triage process. If you were in a clinic and you're an advanced practice nurse now, you want to go ahead and maybe look at workload overall between, say, 3 or 4 advanced practice nurses, maybe some physicians, as far as how can you optimize the actual amount of time that you spend with patients, things like that. So give me at least an idea what that will look like. The first option is just to draw it out by hand. I actually had someone a couple years ago do it in crayon. It was like, at first look at this, what the heck? And it was like, hey, this is pretty cool. I mean, it was drawn real well, and I guess she used her kids' crayon set. But it's like, oh, this makes a whole lot of sense to me. In fact, a lot of times, if you're in different teams, wherever, whatever healthcare setting, you'll start probably with the whiteboard and some markers and stuff like that, and begin to diagram this out. So that's perfectly okay. The only thing I ask is it's easier for me to look at it and evaluate it if it's scanned as opposed to taking a picture, because the picture tends to be kind of small and it's really hard. So if you have a problem with that, just let me know if you're going to do it by hand, and it's perfectly okay to do it by hand. The other option is to use either Word or PowerPoint. I'm assuming all of you have Microsoft Office. Just nod your head if you got, okay, all right. So in Microsoft Office, and I'll spend a few minutes, it's easier to do in PowerPoint than Word, and I'll show you actually how you can do a simple workflow diagram using some of the smart graphics and stuff like that. So you can do it in Word or PowerPoint. Also, you can do it in Visio. Now, I'm not clear. I've got Visio as part of my Microsoft Office suite. Could some of you guys look and see if you've got Visio? It's probably buried in there. You got to go in and find Microsoft Office, and then it's somewhere down in the drop-down box for the applications that you have. I think at some point, I know Microsoft bought out Visio. It was a separate company, and you used to have to pay for it separately, but I think it's included now with Microsoft Office. So tell me if any of you guys have Visio. Microsoft Visio.
I have it. I used it last semester for a project that I did for infection prevention.
Excellent. Anybody else have Visio?
Yeah, I have it too.
All
I've
right.
never used it, though.
So what I'm going to do is I'm going to do two things. One, I'm going to show you real quickly how to do this in PowerPoint, but it's much, much easier to do this in Visio, and it looks cleaner and nicer and stuff like that. So I'm going to show you both software programs. I've got them hopefully set up pretty well. So we'll go ahead and take a look at that. The other thing I'll point out, if you look down here, there's a couple links. Have you guys looked through these links yet? Look through the HRQ link in particular. I think that's the most helpful one. It tells you a lot more about the mechanics and what are some of the different symbols mean and things like that. I haven't watched the video in a while. Did anyone watch the video? Okay, yeah, like I said, I haven't watched it in a while, so I can't remember it very well. Let's look at a couple examples. I think I got one here. And this is one of the examples here. And this is just a basic symbol set. Can you guys see the symbols right now? Did that come up, or do I need to stop and restart the share? What are you guys seeing right now?
Do you have two screens?
We just see Canvas.
Okay, let me stop. In fact, let's do this. Let me share this. You guys seeing the PowerPoint right now? Okay.
Yes.
So this is one of the links. So you can go ahead and look at this at the link. I can't remember. I'll go back in a minute. But I'm going to show you a basic workflow diagram. Can you see that? Looks like a bunch of spaghetti if you didn't stir it and it's all gobbled. Just kidding. So there's a couple things here. First is this is just a laid out process. This is about a patient check-in process. Probably bread and butter, something that you want to think about. Patient check-in process or lab process, things like that. It has a start point. The patient arrives, and that's what this box looks like. It's usually round or something like this. And then there's different things that happen. So we can actually see the patient signs in, he arrives. Is this a new patient? So that's a decision. It depends upon whether the new patient, whether it's a new patient or not, what actually happens. So it's called branch logic. So either the patient gets all the forms. How many of you ever went to like a new doc or new clinic, and I think it's like this thick, and you got to start filling all those different forms. But again, that's important because that's part of the information flow, the data collection that they need. Also, how many times have you filled out almost like the same identical form every time you go someplace? That's some of the things that can be addressed as far as if you're trying to improve workflow. If you just collect the data once, especially if in some kind of electronic format, it should be following the patient. The patient shouldn't have to be refilling out forms or asking the same questions. Okay, so this just shows you some of the different branch logic, the decision points, and sort of goes through and all the way. Let's see, all the way to the end. It says patient's ready and can come back into a room and stuff like that. Room assignment, things like that. I mean, you can look at it, say if this was an admission into a hospital, all the things that might have to happen, and so forth. Notice horizontally, there's what's called a swim lane for the patient. So these are the things that are specific that the patient's responsible for. And here's the large swim lane here is the front desk of the receptionist. So this is pretty much a front end process. It's an intake into, I guess, a clinic or something like that. So does that make sense to you? if we got a little bit more sophisticated, and this will come up when we look at Visio, you can actually say, not only the patient just fills out forms, but you can actually say, what are the actual forms that have to be filled out and where would they actually go to? For example, if there was a lab collection, there might be a lab form and it would be a different symbol. And then it would go off to another swim lane into the lab and some of the sub processes that would happen into the lab. Let's say it was a pre-op visit or something like that. So for our purposes for the class, the main objective is just to get familiar with how to actually diagram out a workflow so that you could be functional at some point if you needed to do this in the future, or if you were in a setting that was doing workflow analysis or quality improvement, process improvement, things like that. If you saw some of these, it would make sense to you. So that's the main objective here. Not to see how well you can draw and things like that, but gives you at least an idea as far as mapping out the process. Any questions up to this point? All right, let's have some fun. Let's go back. Let's see, I gotta stop share here. Let's see. Well, let's see if this works again. Let me go back here. I'm going to start a new one here. File. Are you guys seeing a blank presentation right now? No. This thing's driving me nuts. That's Word. Nope, that's not what we need. Okay, you see the PowerPoint now? The blank PowerPoint. Okay, good. So let's just start here. I'm going to take this out. All right, and this is a test workflow diagram. Up at the top, if you see where I'm pointing at insert, so I'm going to do insert and see shapes in smart, or do you guys see that? I'm pointing at that right now. Okay, good. So you pull this down and you've got all the different symbols, the things that you can do to actually begin to do to diagram out what we just saw on that other PowerPoint. So let's go back to the triage. Let's see the triage. So I'm going to pull out a box, or let's start of a process. So we're starting the process. And let's just make this readable. Patient arrives. And this is for an ED. So let's say the patient arrives. So now and reports to the triage desk. So this is a lot easier. I'm kind of fumbling with this, but it's a lot easier to do in Visio. But so this is so that's the assessment desk. Now we want to go ahead and actually put in. This is where it's really cool. All these little arrows will map out the different flows, and if you grab it and type it, you see how it's just got docked on that. And now we're going to dock it into where the triage nurse. And what's really cool about that is it will follow if you, and these things in Verbal, you're going to be moving these things around just to clean it up and stuff like that. If it's docked, those lines will go with you. All right. So the next thing we're going to do is put in some decision point. Let's go back here. And now another cool thing, we've already did a line, so we don't have to go through all those different steps. If we just copy and paste, you've already got it set up. So you don't have to keep going to the top line menu here. So again, I'm going to dock this here. dock this here. Let's say we're using a code. So triage code 1, 2, 3, and 4. So if it's 1, actually that's the wrong box. If it's 1, see, this is a little kludgy doing it in PowerPoint, but it does work for fairly simple things. So if this is 1, and then I'm going to insert a text box here. Insert text box. I'm keeping this simple. So a code 1 is basically a code red, or an emergency patient, or let's just say emergency patient. Let's go right back to the ER, back to the bed. Let's do another one. We docked it. I'm just kind of doing this real quick and dirty, but just give you a flavor for what you can do. And this code is non-emergent. All right. So see what I just did in just a couple minutes as far as using PowerPoint. And again, if you dock all this, it'll keep all of the lines clean. They'll follow you along. You have to do, if you do it in PowerPoint, and Word has the same insert, so it looks basically the same in Word as it does in PowerPoint. I just find it's a little easier if I'm going to do a quick diagram or something like that. And then if you're going to put it in Word, all you have to do is highlight it all, right click, highlight it all, copy. Oh gosh, how do I copy this thing? I forget. I'll come back to this, but or if you just want to send me this, that's fine too. If you just want to send me the PowerPoint, that's fine too. And you can do the slide. Just give me a quick outline. So any questions as far as the functional piece? This is like I said, it's a little kludgy doing it in PowerPoint or Word, but it'll do what you need to do for the assignment, and it'll do it pretty well. Spend a little extra time doing it. If you don't have Visio, this is your only option right now if you want to do it interactively like this. So any questions on this? None? All right.
Does it matter how complex the situation or topic is?
The problem with doing workflow diagrams, the more complex they get, they start spilling out into extra pages. So keep it simple enough so it fits on the same page. If you make it too small, it's hard to read sometimes. You make it too big, it just kind of, it blows up the diagram. So basically just do the simple one first. And if you want to add extra sub-processing, things like that, that's fine, but don't spend, I don't want you to spend a whole lot of time on this. Again, the whole objective here is just to get you to just kind of wet your feet a little bit, put your toes in the ocean, just to understand how to do this. And it's it's an acquired skill. There's people that actually have jobs that all they do is workflow diagrams, information flow, things like that, process pieces, stuff like that. So think about what you want to do. In fact, you might want to just sketch it out in the paper just to begin with, and then go to, in this case, PowerPoint. And I'll show you Visio here in a minute. Visio is a lot easier, and it'll make in a minute or two, you'll see why. But this will suffice. It's easy to do. if you want to get fancy and, you know, you want to make this a dotted line, let's see, there's dotted lines. So you want to make that a dotted line. You can do things like that. So it's easier to read if the boxes themselves are clean. Like what I'm saying is they don't have color in them. Color tends to make it hard to read sometimes, especially some of the more gaudy. I think it comes up automatically as either red or something like that. So this looks nice and clean. It's easy to work with. It's easy to understand. All right, so this is PowerPoint.
I do have a quick question too. If, so we're not, I mean, I have the CNS mindset of like, we're trying to fix something, but we're not trying to fix anything. We're just trying to find a process in our clinic or unit and map it out. Is that right?
Exactly.
Okay.
Now, I'll give you some extra consideration if you actually say, here's the process, but here's a better way to do that. And that would be the next step if you were going to do a full, you know, to fully explicate this, you know, things like patient flow through a clinic. What kind of setting are you working in?
Well, previously I worked at the Air Force Academy in the flight medicine clinic. So
Okay.
I'm not working, I'm full-time for Air Force doing school right now, but that's previously where I worked. So that's kind of the most fresh in my mind.
Yeah, that's fine. You can use that, flow through the clinic, things like that. I've got a patient, actually she's a Navy Nurse Corps officer. She's actually doing, she's a pediatric nurse practitioner. She's going for a DNP. And what she's doing is, she's doing something similar to this, but was looking at dependents who just had a newborn, and they're trying to get the second week and third week, all the people that need to see the baby as far as, you know, growth and development, lactation consult and things like that. So what she did was she changed the way they scheduled that 2-week visit after the birth, and she had something similar to this, which is really interesting. And she actually, for a DNP project, is actually doing some analysis and actually showing that it helps you know, beat compliance as far as they had a better the goal was to get all the, I can't remember how many professionals needed to see the moms, but it was easier to get all the professionals to see the mom in the new model versus the old model. So, and she used certain things like this to actually work through the different processes and stuff like that. So for those of you that are, you know, they're going out and like, especially clinical specialists, if you're in the leadership or the informatics program, this is helpful. And even if you just have basic skill sets and working with these workflow diagrams and things like the information flow, process improvement activities, just understanding this and just kind of getting your hands on it a little bit, you're going to be working with folks that do this for a living. But this way it gives you a better understanding how to do this, and you know, how it can help you and others improve processes overall. Okay. Any other questions on this? Let's do Visio here. And stop share. Let me do this. Let me get out of here. Do you have the problem, and I don't know whether it's a recent phenomenon, that you've got too many things up on your laptop or your computer, and it's like 90 things and you can't find the one thing. So I don't know. It's the new normal, the things that we live on in this day and age. I had a nice office. I had all these big screens, and it was really good because I can put stuff over here and there, and I just got my laptop now. So anyway, I'm digressing here while I'm trying to find what I need. Where's Visio? Here it is right here. Okay. So this is Visio. This is what Visio looks like. And look, because I think most of you, if you've got Microsoft Word or a modern version, I think you already have it. So look for it first before you do PowerPoint, because it's going to be a whole lot easier. I'll show you real quickly how easy it's going to be. All right, so File, New, we're going to do a new flow sheet. So this is just a basic, in fact, let's do this one here. This is that swim lane one, okay? Now, let's do this horizontal. So you're already way ahead of the game as far as having this laid out. And let's go back and say, this is patient. Let's go back to the E, if I can spell right. So let's just go ahead and say, I'll fix that later. So here's all your different stuff over here, and you've got plenty more shapes, and we'll pull these out in a minute here. So here's all the different things that you need to do. More shapes. I need the lines. Okay, so we start with the patient. Oh, this is so big. Patient arrives in the ED. Notice I just sort of grabbed and drew that over. All right. Okay, good. Let's add one more swim lane. How do we do this? Let's add one more swim lane. Let's just put EDRNs. These are the nurses in the back versus you know, the Triage nurse out front. The lines here are these dynamic. Can you see that where it's, I'm pulling over dynamic connectors? That's the same thing as we just did. See how quick and easy that was in Visio compared to what we had to do for PowerPoint. All right, and then come back up here. Oh, we need to put a decision in here. Let's just do this one here right now. So, all right, let's do this. Now, I'm going to click on the line and see, we're actually typing right on the line now. See how nice that is. So we got it docked. I undocked this for some reason. Critical care bed, so forth. It took us about half the time to do this, and I was fumbling. I haven't used Visio in a long time. So see how much easier it is. You got the swim lanes now. You can actually see the ED nurses. So Hannah, if you really want to go crazy on this assignment, use Visio. You're going to have a whole lot of fun. There's different colors and stuff you can do, all sorts of things like that. So that was basically what I wanted to show you here, as far as just functionally how to use the different softwares, the different approaches and stuff like that. The swim lane approach is a little bit more robust. It's not required for the assignment, but as a practical matter, you probably want to think about it because there's going to be, I mean, Kristen, if you're talking about a clinic, you've got all these different folks as far as the front receptionists, you've got, you know, maybe different service lines and things like that you might have to include. Referrals, you may have to refer out and things like that. So if you have Visio, I would strongly recommend using Visio to go do these more complex processes. Otherwise, you know, the PowerPoint or the Word, Microsoft Word can do that. I don't know if you can do these swim lanes really well in Word. I think it'd be almost impossible in PowerPoint, but again, I don't want you to spend a whole lot of time just tedious stuff. I really want you to get the idea as far as here's the workflow, here's what's going on, and here's some things that we can do to go ahead and improve the process or something like that. All right, what do you think? You guys excited about this? Not really. It's like one more assignment, yay.
That's interesting. I think it'll be fun to work through.
Just just spend a little bit of time with it. It's kind of an acquired taste. I think the hardest thing to do is you already know what your processes are. You're really good at your processes as well as all the workarounds when things don't go well. This is a way to directly visualize those processes in a way that you can share with others and hopefully improve the process, or maybe use it for education purposes, other things like that. So it's a handy tool, and it fits pretty well with informatics, especially when you begin to think about mapping out processes into the electronic health record. Anybody here in the informatics program? I don't have any informatics. I know I've got 2 or 3 in the class. One of the hard things, if you're in a paper-based record system, most hospitals have gone over electronic health records, but there's still, clinics and things like that are still paper-based that are trying to go electronic health records. You just can't take a form out of a clinic or any setting and just paste it up, into the computer. It just doesn't work. You have to do workflow design and really, even more important, information flow design if you're working in an EHR environment. So think about if you're doing order entry. Patient comes into the ED. Here's our chest pain patient. So you have to draw troponin levels and other cardiac enzymes. That's an order set that has to be mapped into the workflow, but it also has to be attached to a unique patient and a patient ID. So think about this. In the olden days, if we had a trauma, they come in either by ambulance, they come in by the helicopter, and inevitably we didn't know who this patient was, so we had this packet. It was just basically it was a sequential numbers and stuff like that, and they got a wristband, and it got attached to all the other labs and x-rays and things like that. Well, that's fine in a paper-based system, but in an electronic medical record, it's much harder, because now you've got problems with that number. Now has to be changed by someone when you actually figure out who this Jane Doe, this John Doe is. So you have to begin to really understand and map out the overall patient flow, and the workflow and the information flow within the system. It's not easy to do, but these are some of the basic tools that nurses will use, if you're in a leadership role, if you're in an informatics role, to go ahead and begin to think about how do we actually do the actual workflow and map that out into the EHR. And it's interesting. I have a lot of friends out in the industry, and they do a lot of work either on the clinical side or on the vendor side. And one of the first things that has to happen is they have to begin to map out the workflow in order to adapt the electronic health record into that particular setting, and adapt the different screens, the forms, and things like that. So these kind of tools are really, really important when you're actually doing process change, or even if you already have an electronic health record. I've heard hospitals spend millions of dollars. They're not happy with whatever system they have. They're moving to another system. Now they have to redo all of this, and it's really, really important, especially when you're talking about orders and lab values. You never want a lab value come back to the wrong patient, things like that. So is this helpful? I'm just trying to give you a kind of a feel for things. What kind of questions do you have at this point?
I don't have any other questions. You answered mine.
Great. I'm going to take this out here. Let me stop sharing. What's your dog's name, Hannah? Every time you come on, I see the dog. I usually see the rear end of the dog.
Yeah, his name's Dallas. He follows me everywhere. He's glued to me.
Oh, really? He looks like a good family dog.
He is. He's got a lot of separation anxiety issues. He was a rescue, so
Okay.
he took to me, and so he follows me everywhere.
Everywhere, even into the bathroom?
No, I close the door. He'll sit in the bedroom and wait for me.
And wait for you to come out. Okay. Yeah, our cat follows my wife into the bath. He said, no. I draw the line there.
My dog, we have lever handles, so my dogs just open up, come on in.
Oh, God.
Along with kids, too.
Kids, okay, yeah.
No boundaries.
Right?
Privacy, yeah. Anything else I can help you guys with? Okay.
So
Yeah.
I just wanted to clarify, we don't have to say where the problem is, but if we identify, if we're doing this workflow and identify there is an issue, we can identify that if we want to.
Yeah. Like I mean, simple things like, a classic example would be back to the ED. You're trying to decrease patient wait time to get back to the ED. So, it might be something simple like, here's the process. We don't do anything until the patient actually gets back. And we're going to change this process and saying that, the nurse has orders, a standard set of orders. They can go ahead and do basic labs or do an EKG before, or probably not EKG, but basic labs or some other things that can improve the process so that, they're not waiting to bring the patient back and then waiting again to get the labs. That's kind of a good, basic idea as far as how to look at the process. How do you change that? You've got a specific goal. So for example, if let's say your wait times in ED are 45 minutes, you want to get them to under 30 minutes for non-emergency patients. So you need to start with the process and then how can you change the process in order to get there and then reevaluate. When I was in Florida, they had a really huge problem. They had up to 6-hour wait times in the ED. And it was interesting. What do you think the main problem was?
They're losing their patients.
Well, that was part of that was patient dissatisfaction. It was getting, and this is Lakeland, which is between Orlando and Tampa, and it was this huge hospital, and it was like almost like 700 beds, and it was the only really hospital in the area. And it was getting into the paper, the local papers and stuff like that. What was the problem? What was the problem? They fixed it, but what was the problem? They couldn't get a bed to admit the patients to. The problem was on the back end, not in the ED. They'd have all these patients they needed to be admitted for whatever reason, and they couldn't get them beds because they were all stuck with getting the people out of the beds that needed to be discharged in the hospital. So they did this huge project, and they really did a good job. They got them down to under an hour total. I mean, all the wait times went down to under 30 minutes, but actually getting through the ED and actually into a bed went down to I think an hour and a half or something like that from the time when they actually decided to admit the patients. So again, those are all just classic clinical examples that involve process improvement, that these workflow diagrams would be really helpful to begin to think about teasing out these things. The only other thing I'll mention just for completeness, and it's not part of the assignment, is once all these different processes can be laid out, there's a whole, it's called simulation. There's a whole science. They're called operations researchers. They can actually use simulation, actually mathematical models to actually begin to different processes and things like that. So for example, the one I got peripherally involved with when I was in Charleston, I'm going to turn my video off for a second. Can you guys still hear me? Okay, I was getting the freezing thing. That they were actually looking at going from pre-op to op to post-op, and they were looking for different bottlenecks, things like that, information flow. So it was really interesting. They actually got into these different mathematical models, and they actually did a couple like what ifs. What if we changed this process to this, or what if we called the housekeeping to get the bed clean right as they were finished closing the wound, as opposed to waiting until they got to the PACU and things like that. I think let me see if my video will go again. Yeah, I'm back. So again, these are just some of the things that you'll see in real life. We've all experienced them as nurses, and nurses are really, really, really good about workarounds. If you got a process not working, we'll figure a way to get around it. That's what we do. We do that well. The whole idea is that to change the process so we don't have to do the workarounds. And whenever you do a workaround, there's always a chance something can happen, and you want to be careful about that. All right, that was my spiel for tonight. I've been going since 8 o'clock this morning. I can't remember. I think this is my sixth Zoom today. How many of you are just absolutely just you never want to see Zoom again? It's been crazy. In fact, I had a meeting with the dean today. We were kind of talking about that. He was saying he hadn't even been in his office since August. And oh God, how's things going? I says, I don't know. I think it's going to be a bunch of cowboys when I get back there. But it's like, this is our whole life, Zoom. And as long as we've got enough bandwidth for a fine. But I live in a semi-rural area. So I guess and up on a big hill. So I guess the electrons can't get up the hill. That's the problem, I think. So Anyway, that's it for now. I'll be around tomorrow. I think it's 9 to 10:30 is, I'll just leave the video on. I'm not going to tape it or anything like that. I just want to stop by, just say, oh, I got a question. I didn't think of it last night. And I'll do my very best to get the grades finished on that last assignment. And I think you guys are fine. Is there anyone here or anyone in class that you know of that's graduating in a couple weeks? I'm pretty sure I don't have anyone graduating. The problem is I have to have the grades in, I think on the 12th or the 13th or something like that. So yeah, because it has to be in before graduation. I had one, I think it was last year, maybe, I think it was last December. I had to change times around, stuff like that. But you know, if you have any issues, something like that, just let me know. Otherwise, you guys have this is Thursday night. Tomorrow's going to be Friday. Christmas is coming. I don't know about Christmas shopping this year, but wish you guys all well. And just let me know if you need any further information about the assignment. Good deal.
Thank you.
Adios.
Thank you.
Thanks.
Bye-bye.
Bye.
Oh, let me